Where's the line start? I think we are on. And as I always say, welcome, 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 our Facebook viewers. Pop Barnes Health and Community Tip for the week. We're on 52 weeks out of the year. Well, Pops, why are you on? We're on because the Bible says, my people, what? Come on, y'all. Perish. That's right, for lack of knowledge. And so right now, I'm going to introduce, I'm not going to steal this term because Miss Cheryl Johnson gave me a term that I'm going to start using for this show. But as I always do, I always introduce our community partners, which is Cliatt Life Healthcare with Reverend Dr. Lowell Cliatt, and also New Horizons Community Health with the Chief Executive Officer, Miss Andrea Winston. And we have two guests that I'm going to allow have them introduce themselves after I introduce our community partners. So Andrea, I'm going to have you pass it on off to who you going to pass it off to Reverend Cliatt or to good old Susan with the colorful glasses?
I'm gonna pass it off to Susan. Good morning, Pops. Again, this is Andrea Winston, proudly serving as CEO for New Horizons Behavioral Health. It's a wonderful morning. Glad to see everybody, and we're here to talk about an important topic related to your health, and our guests are going to share what that is. And from there, I'm going to pass the baton to Susan Gallagher with New Horizons as well.
Susan.
Good morning. Good morning, Pops. Good morning, Facebook friends and family. Just want to remind everybody that Wednesday is Veterans Day. And to say a shout out to all our heroes, both active and individuals that have served in the past. Happy Veterans Day. And I'll pass it on to Dr. Lowell Cliatt from Tree of Life Healthcare.
Good morning. Thank you, Susan. Good morning.
Good morning.
Glad to have our guests on with us this morning, Brother Michael, and good to see my good friend Cheryl as well. Good morning, Facebook friends, and it's going to be a wonderful day today. God bless you. We'll pass it to Cheryl.
And now I'm going to introduce my good friend, Miss Cheryl Johnson. She's the West Central Georgia Cancer Coalition. She's been on my other program, Focus on Health. This is my first time having her on Pop's Health and Community Tip Show, but she's going to be coming every second Monday of the month, with the exception of December and the second June 7th, because then we're going to have her on and her son on. And so, Cheryl, I'm going to leave it up to you. Tell our audience a little bit about yourself.
Well, good morning, everyone, Facebook Live. It's a pleasure to be here, and thank you again, Pops, for inviting me. I'm Cheryl Johnson, the CEO with the West Central Georgia Cancer Coalition, and I've been here for 12 years, going on 13 actually in February.
Wow.
But this has truly been a mission and a ministry for me here in our community, and we'll be sharing a little bit more about what we do at the West Central Georgia Cancer Coalition. We did just come off of our Paint the Town Pink campaign and some of the other things, so we'll be talking a little bit more about that. But it is just a blessing to be able to come to Facebook Live and share all the things that we do. And let me just say that everyone on this panel, we have collaborated with, and that's what we are all about, is truly a community collaborative, working with those of us who are working for the least of these, but also working and trying to educate our community. And also, as Pop said, we're going to be doing some edutainment today, and that's educating and entertaining as well.
And that's the term I said I'm going to steal, but I wasn't going to steal it until she said it. Everybody says, Pops, you all cut up so much and have so much fun. It's like a house party, but at the same time, you give us a good education. So it wasn't until I think it was Saturday when Cheryl was in Atlanta, she said, you want to know something, Pops? You have edutainment. So now you've said it, but I'm stealing that term from here on in. When I come over, y'all ready for some edutainment up in here. Now, Cheryl, introduce our special guest too.
Yes, as I said, we are always collaborating with our community, and I am so proud. When you called me, I said, let me call my friend Michael over at John B. Amos Cancer Center, and I'll turn it over to Michael Nwogbo so he can introduce himself and share what he does.
All right, Michael.
Yes, good morning, everybody. Thank
Good
you,
morning.
Bong, for having me. I wondered why this is my first time, being on the show. It might be my first time, but I promise it's not going to be my last time.
There you go. There you go.
I'm happy to be here. Well, my name is Michael Nwogbo. I am the Oncology Outreach Coordinator for Piedmont Columbus Regional here at John D. Amos Cancer Center. And you will be seeing me more, and I'll be on this thing talking about cancer-related subjects. This month, today I will be talking about lung cancer and lung cancer screenings.
And let me tell you something, Michael. So glad to have you on. Looking forward to seeing Cheryl. But then guess what? She got her posse with you. That's you. So that's a good thing. Okay, Cheryl, I'm going to pass it to you right now so you can get started.
Okay, well, thank you, Facebook family and Facebook friends. We are going to just give you a brief history, a little bit about the West Central Georgia Cancer Coalition, and I will share my slides, share my screen. At first, let me try to find it. I had it. There we go. Let's see. There we go. And I'm going to share. And there we are. There we are. Yes. So, of course, we are initially we were known as a Columbus Collaborative, and we were established actually in 2001. So we have been in existence for over 19 years. But in June 2002, that was when the Cancer Coalition announced that we were going to be awarded 8 planning grants, and the West Central Georgia Cancer Coalition was one of those entities who received funding. And so we enlisted assistance from the College of Family and Consumer Science, University of Georgia, and several other entities which brought in and made us to be who we are. Staying true to our vision and mission, we set the goals of preventing cancer and detecting existing cancers early, improving access to quality care of all Georgians with cancer, saving more lives in the future, training future researchers and caregivers, and realizing the economic benefits from eradicating cancer. So in 2008, we actually expanded our services to Troup County and Meriwether County, and so we'll share a little bit more about our areas of where we are. But the great partnership was forged to make sure that the residents in that area were being served through the Cancer Coalition. And so our neighbors in LaGrange, and then in 2010, we stretched our arms across the river, and our board decided to expand services to reach our neighbors in Alabama counties, and a vast majority of those citizens who work and receive health in Muskogee County live in Lee and Russell County. Therefore, our service area region was again expanded, and these counties were added to our area. This is our mission. We want to help reduce the burden of cancer in the communities that we serve. And because of the expansion, we rebranded our logo and mission, which, as you see on the screen, throughout the years, our initiatives, collaborations, and programs were initiated to include what we call our Community Health Advisors Program, screenings, navigation, and education. And as you see, we service a wide variety from Chattahoochee to Harris to Marion, Meriwether, Muskogee, Schley, as far south, Stewart, Talbot, Taylor, Troup, Webster counties in Georgia, and as I said, Lee and Russell County in Alabama.
That's a huge catchment area. Sure, I know that keeps all of y'all very, very busy.
Yes, we are. And we know in the rural areas that services are limited. And so we try to work with either the health department or a clinic that may be there. So in Webster County, there is a clinic, and we're working directly with the clinic to help women get the screenings. And we'll talk a little bit more about that in just a moment. But our family community sponsors were the health department, and that's where I used to work for 15 years. And as a part of the health department, that's how I became involved with the West Central Georgia Cancer Coalition, formerly Columbus Regional Healthcare System, formerly the Doctors Hospital and Houston Hospital, and of course, St. Francis. Those were our founding members. Now, these are the services that we provide: navigation, screenings, outreach, education, and advocacy. When we talk about cancer screenings, we're there identifying and recruiting clients in the target population, providing financial assistance to any eligible client, and then assisting them. So basically what we do is navigation, helps navigate them through a cancer screenings. For instance, if there is a woman, and we'll talk a little bit because I break it down, needs services, needs a clinical breast exam, needs a mammogram, then she can come to us. But we also work with our community partners, such as Tree of Life. We have a John B. Amos Cancer Clinic with Dr. Kenneth Smith. We've had during Paint the Town Pink a clinic with St. Francis, and so we are expanding who we're working with, and then those particular healthcare providers can make referrals to us as well. With the navigation, as I said, referrals come from the community agencies, and then we provide outreach and education. Now, during COVID, we had to restructure our outreach and education, and I think that's with everyone. We're now doing more online things, more online education, and working with community groups in that aspect. And then, of course, advocacy. We're helping clients find the resources that they need. So in last year in FY20, we provided navigation services to 611 people, and our Neighbors Helping Neighbors Cancer Assistance Fund, we helped 80 families in our community, which
Cheryl, can you speak a little bit about that, please?
Yes, during our Paint the Town Pink, any of our fundraisers that we have, the monies that are raised, the donations that are provided to us, the foundation monies that we receive, the state funds that we receive, we put this into what we call our Neighbors Helping Neighbors Cancer Assistance Fund. And this fund was started about 11 years ago because there was a need in our community, because I had a family member who was in need. I looked and looked and couldn't find anything. I called a couple of places and they were giving small, like a $50 gas card, or the person had to call to get other resources, but there wasn't anything locally that we were able to find. And God placed it on my heart. He says, you are here, so why don't you help fill that need? Because I know there are others in our community that are in need. I presented it, took it to our board, and the rest is history. So we have our Neighbors Helping Neighbors, and 100% of the funds remains here in our community.
Well, Cheryl, let me just say this here. That was awesome. And you want to know something? You always have to be prepared for when God puts something on your heart. And then when he puts it on your heart, you have to be resolute enough to step out on faith and know that the good Lord's going to plow the way. And I congratulate. And look, y'all, let's give Susan a hand for that, please. There we go. That's what I'm talking about. Thank you, Susan. Now, Susan, I want to talk about something else. You know, you're covering all the bases. I think that when I was out there doing community health nursing, the biggest thing was using the nursing disease prevention guideline: education, screening, and follow-up. Of the three of those, really powerful is education, because I found out that people don't have to have degrees on their walls. If you give them education on staying health, it's huge. And of course, screening is next as well. But let me tell you something, for all that you're doing, out of the education and the screening, that navigation is huge. Yes. Because I find a lot of people, they don't know how to navigate the social work services that are there for them. So that navigation is extremely important as well. And so let me tell you, and Michael and everybody, people, you all got all bases covered in this ball game then.
Yes, we do. And navigation, and I guess that also, you know, we started off with our Cancer Care Access Coordinator, which is a navigator, and it does a disservice to someone to go out and screen and find, and you don't have that continuum of care. And so that's what we try to do, is to make sure that we have that continuum of care. If we find a woman who has a lump or not, we follow her through to the end, her or him, because men can have breast cancer as well. We follow through until diagnosis or non-diagnosis, and so that's what we try to do. And so with our screenings last year in FY20, we provided 508 breast cancer screenings, which include breast exams, mammograms, ultrasounds, biopsies, and so forth. And so the screenings, as I talked about a little earlier, we do have various entities that we're working with. And Reverend Cliatt with Tree of Life, they'll call us. That navigation, we connect with them. And, you know, as I said, that social worker piece, that's where my degree, my undergrad is in social work. And so as a whole person, you have to be taken, care of and navigated. And so outreach last year, we educated about 4,921 people over 40 events that we either hosted or co-hosted in 5 counties. That's how much information. And of that, we do try to provide information on Quitline, which is so key. We'll talk about with Brother Michael with lung cancer, lung screenings. And during the COVID, in the middle of COVID, we developed a monthly newsletter to equip with the latest news regarding our service that we provide. So we'll make sure that we get you all on POPs. So I'll get you on that distribution list as well. Now, other programs and services that we provide, and you see colorectal, lung, and prostate. There were 3 colorectal cancer events that took place, and we distributed 47 fit kits. This is the collaboration that we have with the John B. Amos Cancer Center in Michael, of which 4 participants received abnormal, and then we navigated them and referred them for additional services. And then also there were 75 PSA tests were distributed, and we again collaborated with John B. Amos Cancer Center during their screening program that they have in September for that.
And Cheryl, I'd like to interrupt you just a minute, just to let the community know and listen to the collaboration that's available in the community, which shows that each organization definitely cares, and they have a safety network to really help the community when individuals in the community don't know where to go or what to do. Now, can you talk to me a little bit about the Fit Kit?
Okay, yes, the Fit Kits are kits that, and again, it was collaboration because our funds were limited at that time, and so the John B. Amos Cancer Center, they purchased, I forget how many, Michael, how many did we purchase? And it was right during the pandemic. Right before the pandemic started. That early March was when we kicked it off, and of course we all know March 11th was when it was declared an actual pandemic. But I want to say, was it 150, Michael?
Well, actually, we the total number of kits that we purchased was 250.
250. Oh,
all
yes.
250 of them, but that's how many we purchased.
Yes, and so with that, a Fit Kit is the immunological testing for colorectal cancer. It's done with stool, and it can be, done at home in the privacy of your home, and then it's back off and get the results back. And if it comes back abnormal, then we provide follow-up services to someone who is uninsured. Now, if they have insurance, then they'll go back to their primary care doctor. But when we do the Fit Kits, those are done, and we'll come back in March and talk about that. It's for persons who don't have any issues, who are not, just the average person at 50. You're supposed to get your colorectal screening done, and then you get a colonoscopy done. And so the Fit Kit helps in between that. Yes, sir.
Yeah, it searches for a
Barnes. Yeah, if I might say something, Cheryl, as well, and reference going back a little bit to breast cancer, we have patients here in our clinic. It's extremely important for the patient well-being and just their peace of mind when the doctor examines them and find a lump in their breasts, and they don't have the insurance or the funds to pay for it, to be able to take that patient and say, listen, we have a place for you, a resource that can take care of that for you and move forward. It just really put the patient at ease and really help us to be able to provide best care with concerns to health.
Thank you so much, Dr. Cliatt. It really is. We try to reduce the burden of cancer in the communities that we serve through financial, if it's a financial burden or not knowing, exactly where to go. And we try to have non-duplication of services, because it makes no sense for 2 or 3, to be doing the exact same thing. And so that's why we try to be that middle person to help navigate and get them to the services. We were just awarded we were just notified that we're going to be receiving some more breast cancer license tag monies. So when you purchase your breast cancer license tag, the monies do come back to our community. You know, it doesn't, you know, when you're buying these special tags, you really don't sometimes know where the money's going. But I can attest that when a breast cancer license tag is purchased, that money goes into a pot and then it's distributed throughout the Georgia, and I'm happy to say that we have been a recipient for over 12 years, getting the money and putting it back into our community. So it, you know, and it's not a small amount. $50,000 is amazing. And what I say to women and men, you have no reason to say, I can't afford to get it done, because that's why we're here. This is what we do every day, all day.
And Cheryl, let me introduce something here that I do on every show. I like for the community to know that the organizations that come on this program, their main focus is your health of you and your loved ones. But unfortunately, in this day's age, you have organizations like Cliatt Healthcare, New Horizons, West Central Cancer Coalition, also really the Piedmont Hospital, cannot provide the services that keep you and your loved ones healthy without help. Okay, Pop Barnes, what is help? I'm going to tell you what help is, that everybody can do it. Everyone can volunteer, because now when you volunteer there and they assign you to a position, that's one position that they don't have to expend money on for a salary. So first of all, everybody can volunteer. But then, unfortunately, in this life, it takes money in order to make things happen. So all of these organizations, New Horizons, Cliatt Healthcare, West Central Georgia Cancer Coalition, Piedmont Hospital, they also need some time. And let me tell you this, no amount of money is too much or too little to give to these organizations that help you and your loved ones maintain health, but not only health, but quality of life as well. And so I always like to mention this at each show, and before the end of the show, you know, my memory goes a little bit, so I want each of you to be able to give your contact information for our Facebook viewing audience. Thank you, Cheryl. I appreciate it. I just want to get that in. It's really important to say something like that.
Okay, well, thank you so much, Bob. I'm going to run on because I know Michael has to come on and we'll talk about that. But just wanted to share with our community some future initiatives. Some we're currently in is to continue to make strides to educate our community about cancer prevention. And so our survivor has been growing. It started about 4 years ago. We have the program in LaGrange. The persons who are survivors can go in. They can take education class on healthy eating. They can do I think Tai Chi is one of them, and then some other health programs. But here in Columbus, we've worked with the YMCA. We're expanding with the new gym. I can't announce it yet, but we're trying to get. We have what we call people certified education specialists or cancer education specialists who specifically work with cancer patient survivors. I'm sorry, has permission from their physician, because you can still be in treatment and still working out, but they are able to at our expense have access to a gym or to a one-on-one training. And so we are just delighted that we were a recipient of the survivorship program monies again, and we are expanding that. A new one, from farm to table. What are we doing with that? That means we're going to be working with some local farmers in our area to provide some fresh fruits and vegetables to survivors, to those cancer patients who may be currently in treatment. So we'll be rolling that out in the spring, but I am so excited about that program because it's so important, you know, about healthy eating. Our butterfly release in Town Pink our butterfly release was canceled last year, but this year if we're allowed to, The 21 in 21 we'll have our butterfly release again at the gardens, and that's where we celebrate survivors and celebrate life, celebrate caregivers, and just celebrate. And butterflies are released in memory and in honor of those who are or who have gone through the journey, or those who may have gone on to another journey. And Paint the Town Pink, of course, we know is our huge 5K walk run, and we just have a great time. People dress up with their pink tutus and their glow evening program, and I mean, we've even had dogs in tutus. I mean, we've had it all.
Hey, Cheryl, if you want to raise some money, you need to advertise. Say, if y'all come out and donate money, Pop Barnes will put a tutu on.
Hey,
I guarantee you have some money.
let me say, I'm gonna make that a challenge when we talk that. That's right. That's right. We
You'll
truly
definitely raise some money on that one.
We truly appreciate that. But those are some of our future initiatives, and just wanted to let everyone know that November, these are several cancer awareness months. I forgot to put on here, of course, it's stomach cancer, pancreatic cancer, lung cancer, carcinoma cancer, and for caregivers. And I did want to share, Pops, this month is Pancreatic Cancer Awareness Month, and I do have a cousin, and he said that you gonna tell him about me? I will. Timothy McCrae, he is battling pancreatic cancer right now, but I tell you one thing, he is fighting, he is a fighter. And I just look at him sometimes in amazement of what he is doing. But we started this journey. I've been there with him. He has a sister-in-law who is also a breast cancer survivor, who's helping him, Rosalind McCrae, and you've probably seen her stories on Facebook as well. But this family, we are going through, but we are working together in the cancer diagnosis. But, you know, I told God some time ago, I get it. I know now why I'm here, why you've placed me here to be here at the West Central Georgia Cancer Coalition, is to be a caregiver. It is Caregivers Awareness Month in November as well. There wasn't a ribbon that, and there may be, I just don't know, but it is Caregiver Awareness Month as well. And then November 19th is Great American Smokeout Day. And just want people to be aware of that, and you'll probably be seeing some more information about that. And last but certainly not least, these are the opportunities for you to be involved. Go to our website to make a donation, follow us on Facebook, or give us a call at 706-660-0317. Thank you so much, Rob, for the opportunity, and we look forward to talking to others.
Well, let me tell you something, Cheryl. You and your organization are just a blessing. The community has heard now all that you do. And what I want you to do, Cheryl, when we end, I want you to talk more about the license plate. When you were on my TV show, Focus on Health, you should have gotten some calls, because that was the one thing that I had a lot of the people call me on. Pops, what did she say about the license plate? So if you hold that thought, after Michael finishes his good presentation, I'm going to have everybody else chip in and say something. But I want you to go back and refer to that, because that's a way that you can have money coming in. People need to know the good that they're doing when they do it. And guess what? It's for the community.
Absolutely.
And so I'm really excited. I went over Michael's slides, his good slides. So Michael's going to be drafted too when you come on, if he has time, so he can come and do some more good slides. So Michael, I know Cheryl's going to put your slides up for you. I'm going to pass the baton to you.
All right.
I am. And there we are.
Okay. So, like I said earlier, I am the Oncology Outreach Coordinator for Piedmont Columbus Regional here at John B. Amos Cancer Center. And part of what I do is to bring awareness to our community regarding cancer, different kinds of cancer, to educate our community, Columbus and Muscogee County, about those diseases, and also provide some screenings of different kind of cancer diseases. So next slide. So November is actually Lung Cancer Awareness Month. So I picked lung cancer to talk about lung cancer to bring that awareness to our community. So, like I said earlier, awareness is important. What is awareness? You're screaming, lung cancer. You want people to know that there is something called lung cancer. And you also want people to know, what the prevalence is, if there's any, in our community. So we know that lung cancer is the leading cause of cancer-related deaths in both men and leading cancer-related death in both men and women. And we know that in Muskogee County, Columbus, that number is even higher than the national.
Oh, wow.
Yes, much. It's so alarming, that the numbers are so staggering that is higher than the state rate and also higher than,
That is alarming.
People always ask me why is that, why that data, that figure in Muskogee County, we really don't have any answers. People have mentioned to me, maybe because we had all those meals back in the day, that were in town, but we really don't know the right answers. We have a high rate of smokers still. That could be a contributing factor, but nobody knows for sure. But it is higher than national and state average.
Wow.
Yes. So we also know that more than 50% of lung cancer cases in the United States, are from smoking. So going back to smoking again, since our numbers are higher than the average, the states and national in smoking. So we have to work on that also. So now that brings me to the third item, which is what are we doing? When I say we, I mean Piedmont, Columbus Region, and John B. Amos Cancer. What are we doing to help curb or reduce that rate of cancer-related death in our community? So some 7 years ago, we started our lung cancer screening program. It's a low-dose CT scan that, anybody, even when you are, your body don't tolerate the dye that they use in the CT scans, we only give you a low dose. So most people, if not, I want to say 99% of people can tolerate it, can take it. So
that's awesome.
Yes. So that's what we have going on now. We've been doing that for 7 years now. Next slide. So who should get screened? Because you have to qualify. I mean, it's not everybody cannot get screened. According to the Medicare CMS, that gives us the guideline. So they said you have to be between the ages of 55 and 77 to qualify to get screened. That's number one criteria. Secondly, you have to be either a current smoker or you have smoking history and you've quit smoking not later than 15 years ago. So how do you characterize a smoker? So you have to have at least 30 pack year, and your 30 pack year is 1 pack of cigarette per day for 30 years, or 2 packs of cigarettes a day for 15 years to qualify. And thirdly or lastly, that the criteria that qualifies you is that you don't have to have, if you already have lung cancer symptoms going on, then they will not screen you for lung cancer. So
and Michael, I'm so glad that you're talking about. Last week, Ms. Gloria Mott spoke about COPD, and a lady called me and she said, "Did you really smoke and inhale a pipe?" Well, you want to know something? Back then, and I'm 77 now, so way back then, people did not know just how harmful cigarette or pipe smoking was, and I smoked at least a pack and a quarter of cigarettes, what they used to call the chest busters, Chesterfield. and I also smoked a pipe. I'm talking about I stopped when I was 30. I think I thought after the program I tried to figure. I was 34 when I stopped smoking, and so but nowadays when people know how harmful cigarette smoking is, in fact, it's written on the side of the packet. You would think that people would stop, but we also spoke about just how addictive nicotine is. And I wanted just to stop and let individuals know, first of all, if we're leading high in this area with lung cancer, if you are a smoker, there's too much help out there for you not to at least try to do it. Now, that's an alarming fact that you brought up, Michael, that this is higher than the state or national average. That's huge. And
Yeah.
so I will just want to interject that there's all kinds of help. They have the patches, they got the gum, they have all kinds, but I believe in groups that you can join to stop smoking. And so, Michael, this should be an eye opener for a lot of people. The statistics that you're mentioning.
Yes, and I'll talk about the groups, different groups, ways that you can, try to help yourself, with, trying to stop smoking. We do have help out there, but I want to talk about, you mentioned, if you, if you don't mind smoking, if you have that enough energy to smoke, you should have the same energy to go get yourself checked out to make
That's
sure
right.
that you have not done anything to your lungs. And I also get questions like, well, what if I quit longer than 15 years? What do they have to put that cutoff at 15 years? Their reasoning is after 15 years and you didn't experience you didn't have any lesions or any problems in your lung after 15 years, it's likely or most likely that you might be okay. So that's no need screening you when you survived 15 years post smoking. So that's why Medicare. That's how Medicare look at it. So and I also talked about the symptoms. So some of the symptoms of lung cancer will be, if you're coughing up blood, that's a symptom. If you're having like a difficulty breathing, I'm talking about real difficulty, and you don't have a history of COPD, that's a symptom. And several other symptoms that they'll run down the list when you call to schedule that. Make sure that you are not already symptoms. A lot of people don't think about screenings until they start having symptoms.
Right.
Every other cancer screenings that I do, you have men, that knows that at age 45 or even 40, as an African American man, that you should have started screening. They don't do it, and they're 55 and they start having symptoms. They calling me like, "Oh, I heard about your screening last month, but I didn't make it.
Right.
Can I get it now?" I'm like, "Why?" She said, "Well, because I have something going on."
Right.
So you don't have to wait till you start having symptoms to go get yourself screened.
Exactly.
So another set of questions that we get a lot is, will your insurance pay for it? So when we started the program, CMS was still looking at the possibility of paying for lung cancer screening. And then they came up with a policy saying that, if you have a program, which we here at Piedmont, a program will comprise of, you have to have a team of specialists, which a thoracic surgeon has to be a part of it. You have to have a team of specialists that will look at the imaging in case there's any suspicious lesion. So you have, like a cancer tumor board, that has to sit and look at. So we have all of that. That's how they were able to get us on the list. So they'll pay for it if you go to an institution that has an established program. Your private health insurance, most of them also pay for it because they follow whatever the CMS, Medicare, puts in place. They follow, that's what they do. However, we always encourage people, that has private insurance. If
Right.
you meet all these qualifying criteria, you might have to give them a call just to make sure that they'll pay for it before you call us to schedule that screening. And also, we also get questions where, okay, what if they find something suspicious and they need, extra investigation? Your insurance, including Medicare, will pay for those, additional, investigations. So say they do that CT scan and the thoracic surgeon sees suspicious lesion that they can tell exactly if it's malignant. Sometimes they do a PET scan. Your insurance will pay for that too.
Right.
That's what I'm just trying to point out there. So now the next thing is, what happens after the screening? Say you call, we have a nurse navigator that will screen you over the phone, ask you all those questions to make sure you qualify. And then she'll schedule an appointment for you to come in and get that CT scan. So after that, what happens? So what happens is, they do your screenings, and the radiologist will now send your result to the thoracic surgeon, who will personally look at it. If he sees anything suspicious, in addition to what the radiologists have looked at and, his note, the thoracic surgeon will determine if he needs to present your case to the tumor board, so that the
Right.
group of specialists will, also look at it, and everybody keeping their 2 cents, regarding what next, the next steps will be, what they needed to do. So that's what happens, after your screening is done. So next question is, what happens if your screening shows that you have cancer? Because we want to rest assure everybody that here at Piedmont, we have a team of specialists that will treat you, and take on your case. We have, like I mentioned earlier, we have a thoracic surgeon. We have several pulmonologists. We have a radiation oncologist, several of them. We have medical oncologists. All of them work as a team, to take care of anybody and everybody that, that we've screened and, came back with lung cancer. And in addition to that, we have a nurse navigator, a lung cancer nurse navigator. Her only job is to navigate every lung cancer patient. So she's the one that schedules the screenings. The report goes to her. So once you are diagnosed with cancer, lung cancer, she will take on your case. She'll give you a call and she'll navigate you, pretty much holding your hand through the whole entire journey, through
Right. That's
diagnosis
important.
and all of that stuff. Yeah, so we have a designated nurse that will do that here at the center. So on that last slide will be her information, her number. If you think you qualify, based on the criteria that I talked about earlier, or even sometimes even when you don't think you meet all of that, criteria, you can still give her a call and see, what she can do to get you in. And I also want to talk about, say you don't have insurance at all. You can also pay out of pocket. The price is not outrageous. It could be for a lot of people, they'll charge you $199 and nothing more, to screen you.
But I think everybody's like, if they don't have insurance, $199 is enough to assure you good health if you get screened. Now, let me tell you something I would like to do before we close out. I'd like to start with Dr. Cliatt. Would you give the contact information for Tree of Life, please?
Yes, thank you. Address is 1968 North Avenue, here in Columbus. We're on the campus of Piedmont Medical, adjacent to the emergency room. Our telephone number is 706-225-0355. You can go to our website, learn more about us, and also if you desire to give, that's www.treeoflifehealthcare.org. Go on to donate, and you can be navigated through PayPal. Thank you.
Thank you so much for that information, Andrea.
Hello, Pop. This has just been wonderful information. So glad that our guests could come and be here with us. Again, I'm Andrea Winston, and I can be reached at 706-596-5582. And Susan's going to give you all the Facebook and website information if you want to reach either of us.
Great.
Susan?
Yes. Yes, sir. Thank you. Just a reminder to everybody that we are wonderfully made in the image of our Creator, mind, body, and soul. At New Horizons, you can visit our website at www.nhdh.org. You can follow us on Facebook, or if you want to have a community education event, maybe a training on suicide awareness, you can contact my office at 706-596-5517.
And Cheryl, say that one term again, edutainment, that we have given to our Facebook friends and public. Entertainment, you understand? Cut up and have fun, but educate you too. So give your contact information, Cheryl.
Yes, I shared a little earlier, but it's www.gcc.org. Our number is 706-660-0317, and they can like us on Facebook, Twitter, and Instagram.
All right.
And Michael.
Yes.
Give all your contact information to our Facebook viewers.
Okay. For the lung cancer screening, our nurse navigator's number is 706-320-8615. That's who you call to schedule an appointment to get screened for lung cancer. However, to reach me, my number is 706-321-6603.
This has been a power-packed show, and I knew it would be. Hoop hoop for our entertainment with Cheryl and Michael and Andrea, Reverend Cliatt and Susan, and me, Pop Bonds. And as I always say at the end of the program, please be good and kind to yourself because God loves you. Thank y'all.
Thanks, everybody.
Thank you, everyone.
Have an amazing week.
Thank you.
Bye-bye.
Bye.